Advil, Tylenol, aspirin, Aleve, oh my. Confused on what to grab at your pharmacy when you have pain? I was too. First, let's go over the common pain medications. There's Tylenol, Advil, Bayer aspirin, and Aleve. You might hear people say other names such as acetaminophen for Tylenol, ibuprofen for Advil, aspirin's usually just aspirin, and naproxen for Aleve. I was going to give you a mnemonic to help you memorize this, but guys, it's always on the bottle. So what is the real difference between brand and generic? Well, there is none. They have the same safety and efficacy. I always buy generic, except I prefer brand Advil because the pink tablets taste delicious. Anyways, to figure out what medication to pick, it depends on what ails you. To simplify the choices, I am assuming you're a healthy person. So if you have a fever, just pick Tylenol. Tylenol is the most central acting out of all the medications, so it is best for fever. We actually don't know how the mechanism works. The other three medications are called NSAIDs, which stand for non-steroid anti-inflammatory drugs. NSAIDs are best when you have aches and pains, and your aches and pains happen usually because of inflammation. Inflammation is our body's natural response to injury. It's basically trying to fix you up, but by doing so, it could cause some swelling and pain. Inflammation comes from the outer part of our cells, called phospholipids. The enzyme COX turns the phospholipids into fatty cells called prostaglandins, which cause the inflammation, the redness, swelling, and pain. NSAIDs block the COX enzyme from working, so it is essentially blocking inflammation. Remember, all of these medications have side effects, so don't just pop these like candy. It can cause stomach irritation, interact with your blood, and interact with your kidneys. Now, you're probably wondering which NSAID is right for me. Again, we have our Advil, aspirin, and Aleve. Well, let me just straight up tell you, don't pick aspirin. It has the most side effects. And it really should only be used if your doctor wants you to take a low dose for your heart. Now we have Advil and Aleve left. Well, honestly, they're very similar. The biggest difference is that Aleve works longer while Advil is shorter acting. So for me, when I have my period, I choose Advil because I know it only hurts for a short time. While my dad should choose Aleve for his back pain since I know it's going to hurt him all day. And to review, Tylenol, we use that for fevers. Remember, don't take more than you need. If you want to learn more about these medications or how to prevent side effects, let me know in the comments below. As always, thank you for watching and hope you feel more confident when you get to the pain aisle at your local pharmacy.